This is a narrated PowerPoint submitted by Hollis Steeves for XNB382 Assessment 1. This presentation will start with an initial client consultation, which includes a new client screen, client information and medical history, pre-exercise screening tools used and their results, initial consultation notes, a needs analysis, and finally a conclusion, which includes a summary, action plan, and recommendations. The client is a 22-year-old male with a weight of 90 kilograms, height of 173 centimeters, and a resultant BMI of 30, putting him in the obese category. He has a waist circumference of 96 centimeters, a mid to high range body fat percentage. He is hypertensive and has prediabetes. The informed consent was obtained prior to the consultation. His current physical activity status includes 1 to 2 sessions per week, each lasting 30 minutes. This includes playing futsal once per week. The reason for appointment was he was recently diagnosed with hypertension and prediabetes by his GP. Due to his family history, body composition, sedentary lifestyle, and young age, he is concerned for his long-term health outcomes and is seeking recommendations. His medical history includes hypertension, family cardiac history, a knee injury due to a motorbike accident, and no currently prescribed medications. A broad range of assessment tools were used in determining his readiness for physical activity and exercise. The results showed that he's a moderate risk client and therefore may need to obtain a GP review prior to commencing vigorous intensity activity. However, he is cleared to commence light to moderate intensity exercise. He does not, however, meet the Australian Physical Activity Guidelines. The initial consultation notes show that he's a full-time university student and works 2 to 3 days per week in a nursing home. Therefore, his ADLs include going to university, doing housework, riding a motorbike, and his physical job in the nursing home. He currently lives at home with his family and prefers to have an at-home exercise regimen or one-on-one training. His health goal is to improve his body composition, reduce hypertension, and reduce his risk of chronic disease. His behavior goal is to improve daily habits to adopt an active lifestyle. His exercise goal is to increase tolerance of longer duration aerobic activity. The practitioner goal is to devise a program that is safe for the client to participate in, promotes a healthy lifestyle, provides lifestyle education, improves body composition, increases aerobic endurance, and ultimately reduces and prevents chronic disease risk by increasing insulin sensitivity and decreasing hypertension. The needs analysis for his health goal shows that exercise, particularly a combination of endurance aerobic training and resistance training, can prevent and reverse hypertension in young adult men, while increasing insulin sensitivity, resulting in an overall reduction in chronic disease in the individual. The needs analysis for his behavior goal shows that by increasing his overall health, his enjoyment of social sports such as futsal will increase. Therefore, he will be more likely to participate in other social sports and therefore increase his health outcomes. Needs analysis for his exercise goal shows that by increasing his ability to perform longer duration aerobic activity will encourage his participation in exercise by reducing his discomfort and allowing him to be more successful. Ultimately, this will also contribute to his behavior goal by increasing his enjoyment of social sports. The action plan for his health goal is to have an at-home plan of light to moderate intensity endurance aerobic training in conjunction with resistance training. In addition to that, he'll have one one-on-one session per week to assess his progress. Finally, he'll need to see his GP for a medical review to determine if he is able to participate in vigorous intensity exercise. The action plan for his behavior goal is to complete a daily exercise and diet journal and to bring the journal to one-on-one training for education sessions. The purpose of the journal is to encourage his use of an internal locus of control. An internal locus of control, in other words, motivation from a person's health outcomes, as opposed to an external locus of control, such as worrying about one's appearance, is a more effective motivator in exercise and diet adherence. His action plan for his exercise goal is to have 3 sessions of endurance training each week, which will be increased in duration and quantity each week. In conclusion, the client is a moderate risk for physical activity and exercise and is concerned for his long-term health outcomes. He wants to improve his body composition, reduce hypertension, reduce risk of chronic disease, have a more active lifestyle, and finally, increase his tolerance for longer duration aerobic activity. To do this, I've prescribed an at-home program with one one-on-one training session per week. He also needs to keep a daily diet and exercise journal and increase the quantity and duration of his endurance training weekly.